It has been nearly 7 months of families working at home, often in makeshift workspaces that are far from comfortable. And now adults and even children are starting to feel the aches and pains of staring at a screen all day long. And joining us now with the symptoms to be aware of and steps to improve your physical and emotional well-being is Dr. Colin Haines of the Virginia Spine Institute. And welcome back to Good Morning Washington, Dr. Haines. Good to have you here.
Good to see you. How are you?
Great. Let's go through your symptom checklist. What are the most common ailments that people are complaining about, and what can we do about them?
So it's not lost on me that 2020 has been a very challenging year. There are a lot of things going on in all our lives, and frankly, one of the last things on the docket for us to care about is our spinal health. Now, that being said, I can speak from personal experience as a father as well as professional experience in terms of seeing patients in the office that we're having more injuries, repetitive use injuries from staring at computer screens constantly throughout the day. Two of the most common things that I see day in and day out from staring at screens are both headaches and eye pain or vision problems. For headaches themselves, our body seems to experience stress more in the head than anywhere else. Also, if we're just staring at a screen constantly throughout the day, not getting the blood flowing to our head as much, not loosening up the muscles, it can result in significant pain in the head. So what I recommend, try to relax. I know it can be hard, but breathe, try to enjoy the good things in life, and move the head around as much as possible and stretch the neck. Now, for the eye symptoms, I talked to some of my friends at the American Academy of Ophthalmology, and they've got a great rule called the 20-20-20 rule. Now, what that means is every 20 minutes, take a break from staring at a screen for 20 seconds and look off into the distance at least 20 feet or further. It allows you to switch from near sight to far sight.
So other than those two, headaches and eye strain, are there other maybe less obvious physical strains from remote work that might go unnoticed?
So we're definitely, in general, not sitting in the best ergonomic scenario. If we're lucky, we have a workstation at home, but more commonly people are working using their pillows as their workstation or even on the dining room tables. But what I brought with me was a model of the cervical spine. And this is a clear example of what can happen when we have what's called tech neck. Tech neck is something that we're looking at our cell phones more than ever. We're also staring at computer screens with our necks hunched forward. Now, when that occurs, two things happen. When you bend forward, you stretch the muscles in the back of the neck, and also you can squish the discs, these spots in the front, these gelatinous shock absorbers, just by sheer pressure when you're bending forward. Now, over time, that can result in micro injuries that can accumulate. So for our kids and ourselves, in general, I'm not so concerned about the immediate with that, more so 10, 20, 30 years down the line, that could manifest as early aging in the neck. In order to prevent that, elevate the computer screen. When you're looking at your tablet or your iPhone or whatever phone you have, try to keep it relatively eye level.
All right, so, let's talk about our kids, too, because they're all working from home as well. So is there something we should be asking our kids every day about how they're feeling? And if so, what is it?
So when I talk to my kids, I ask them if they're having any vision changes, if they're developing any headaches, and I try to remind them to take as many breaks as possible. It is a Herculean effort to get our kids to focus on school, and especially when they're looking at tablets. But I try to remind them to take breaks, and I ask them about if they're having any pain in either in the neck or pain radiating down the arms that could be indicative of nerve injury.
All right, keeping us healthy during coronavirus, working from home. Thanks so much, Dr. Colin Haines of the Virginia Spine Institute.